in case people could not attend, or if someone would like to learn more about all this information, because it was a lot of interesting information, actually. I have a question here for Ayrton about, do you think that there is a difference that actually richer societies in terms of income use more technology, use more hearing aid than average income countries? Do we have data on that? So is it a matter of money?
It's a really good question. There is some evidence that even within societies, the higher income people get more access to hearing care. So I'm more aware of that than I am of statistics on, certainly poorer countries. I know from having worked in the hearing industry that it does tend to focus from a commercial standpoint, unfortunately, on countries that are richer rather than poorer countries. Hearing aids are unfortunately not the cheapest devices, and implantable devices tend to be very expensive. So I'm sorry I can't quote any particular statistics for you on that, but that I would see as a pretty significant problem in terms of, the World Report on Hearing does emphasize that the greatest lack in rehabilitation services is in developing countries. So there is information out there that suggests it, but I don't have any hard data in that respect. It is somewhere that we need to do better, both in terms of the private companies, I would say, as well as from a public health standpoint.
I was actually in Norway talking about that, and they had some thoughts on that. Even though it's a rich society, they kind of acquired the hearing aids, but they didn't have any higher rate of actually using them. So could it be that it's more of an educational issue as well?
It certainly could be. I know from having a look at some research that does show that cost is not the highest factor, even for individuals, in terms of getting hearing aids. I think you're right that education is one aspect. I think stigma is also a really big problem here as well, in that, as people from one aspect or another might know that they need a hearing aid or might know they have a problem. It's another thing to sort of acknowledge that publicly and wear a hearing aid. I really wish that stigma did not exist. And if you recall one of the slides, it did have stigma encompassing everything that we're talking about in terms of addressing rehabilitation from the World Report on Hearing. So yeah, cost can't be the only thing. I'd say that the prevalence of hearing aids is greater, obviously, in some richer countries, but as you say, there's other factors that are impacting it. And I would say, as you've said, education is one aspect. The other I would really put forward is stigma, but I'd love to hear if you have any more thoughts on this, or our fellow panel members do as well.
Yes, would anyone else like to contribute to this? Mark?
Yes, I would, because you may have seen we published an article in the International Journal of Audiology on the model to evaluate uptake of hearing aids on a global scale, and the first author was Nikolai Bisgaard. And there we saw directly that if you look at overall income in a country, there's a direct link with uptake of hearing aids. So yes, it does make a difference. On the other hand, you also see these huge differences in how that audiology care is provided and how many people know in that country that hearing aids are covered by the reimbursement system. Just for your information, we just published the new Eurotrack on Belgium. In Belgium, hearing aids are covered by the health insurance. 77% of the people with self-reported hearing loss didn't know that hearing aids were covered. The general practitioners in many cases don't know that hearing aids are covered. But you also see a difference in if you have more private care and more freedom of choice, you see that the average use of hearing aids per day increases. And if you have more public models, you see that you may have more people having hearing aids, but the overall use time of hearing aids can be lower. So it's not only about the money, and I agree, it's not about the cost of the hearing aid or the paying, but the fact it's not reimbursed is giving a signal it's not necessary. And if you hear the good news that you have a hearing loss and you need to start using hearing aids, you are not in the best mood of your life. So every excuse not to go for hearing care is very welcome. And then the fact it's not reimbursed or you don't know it's reimbursed is automatically leading to the fact, well, let's then not do it. And let's push it aside because, and that's of course correlated what you just said, correlated with stigma. Having to go for hearing care is a negative signal. It's connected to aging. It's connected to being stupid. It's connected to nearly dying. So a lot of negative connections, unfortunately, which does not lead to uptake. But there is a correlation with uptake, and you do see that, and that is why we also discussed with Shelley at some point that if in a world report you only look at big regions, you also need to look at income, because the overall income does have an impact on provision, but also probably related to healthcare systems being developed, being put in place. So that's also a point there. But yeah, interesting point and interesting discussion.
Yeah, if I may try to sense here as well. It's interesting actually when I suggested children are fitted with remote microphone hearing aids at a young age, they really like them. When they become teenagers, they may stop using them just because of, they don't want to look any different. And also last time we ran a patient group within a project, and this included older adults. It was very interesting to see that they were told, well, we didn't like hearing aids because, yes, people see it, they think, okay, they're old, they're not that intelligent. But then we came across some information saying, use your hearing aid for your brain health. And that was our incentive to use it. Why don't you publicize this a bit more? So I think there's lots of work to do to address the stigma in all societies, not just average or richer or poorer, across, unfortunately. Thank you.
Thank you all. That's very interesting. So Doris, trying to connect everything that we have heard today. I think that it's my perspective that we are talking really about educating more the general public and different medical specialties as well, because I think we are mostly focused, especially talking about APD, in specializing and training medical doctors that are really specialized, focusing on the specific disorder. But if you want to have actually referrals, if we're talking about hearing loss or we're talking about any type of hearing impairment as in APD, then would you think that having specific modules for general medical students would have maybe an impact in the next generation of doctors, of course, and not right away? What's your input?
Okay, I think that it would be extremely important to have medical students from the word go, to get them exposed to what hearing and auditory processing is, because medicine is all about communication. They need to understand, not only because they need to refer these patients, not only because they need to factor in the presence or absence of hearing loss or auditory processing disorder into the diagnosis they consider, but also because when they come across this patient, they need to understand how to communicate, how to talk with them if they suspect that something is wrong with their hearing and auditory processing. So yes, I think it would be very important. I think it's not just about auditory processing. In my mind, hearing and auditory processing go hand in hand. And all professionals who work in health, all professionals who work in education should be taught about hearing loss, auditory processing disorders, and the needs of these individuals.
Thank you. Ayrton or Mark, how about you? What do you feel about that? Safe listening included, of course.
Yeah, I think it's essential. Now, on the other hand, the issue is that the moment that something is complex, it's very easy to be ignored and put aside. And that's what we see. It's also when intervention is complex, when assessment is complex. And let me just give you an example. Sharon Kujawa from the Liberan group is also part of our Make Listening Safe work group and the initiative, right? And you know all her publications on hidden hearing loss. And the issue is that if you have been exposed to noise and your audiogram returns to normal, everybody thinks that all things are fine, but you have a lot of signals and symptoms that are very comparable to APD, because all of those people have attention problems, have problems coping with noise, have problems understanding with noise. And if you just take the audiogram, everything is clear. And the moment that something is very difficult to prove, it becomes invisible. It becomes, there's a very good excuse not to cover it, not to pay attention to it. And I think that is something to be aware of. So I'm very happy with the fact that in this conference and this relation to the relation between safe listening, the World Report on Hearing, and the relation with APD, that you mentioned that. On the other hand, you have a very difficult task because APD is very difficult to bring to the foreground. And although there are good publications and you did remarkable work with your European definition identification on that, you see that's one of the issues we have, is that the complexity is sometimes hindering. And that's also, by the way, the complexity just for hearing loss, because you don't see it on somebody's face that they have a hearing problem, and that it becomes a very good excuse not to do something about it. So that is more my concern than all the rest. I think it's essential. And I also don't know if Doris was showing what can cause APD. There doesn't seem to be a direct link to sound exposure, although it is probably indirect. So what I see from your slide is that if sound exposure is leading to hearing loss, even if it's hidden hearing loss, this can then be linked to APD, and there's something to do about. And how do you see, by the way, Vivian, that direct link? Is it something we can connect to? Is it something we should stress? Because if you make it more direct, it's also easier to communicate about it.
Yes, you are perfectly right. Although complexity is part of being human, really. So we may like to try and simplify things so that people out there will grasp them in a better way. But we have to still be aware that complexity is part of how we communicate, how we acquire cognitive skills, how we acquire language. But I can take your point that it's a nice idea to try and connect the whole hearing impairment stuff and not focus on a specific impairment if we want to have it at a better picture for both the general public and for medical students as well. So I think this is something to think about.
Yeah, I agree. I mean, maybe we should stop by only saying hearing loss, right? There's a lot of hearing issues, hearing functionality that have to go across. But I don't have to stress that point because I'm preaching to the choir, and I know that you all agree with that.
At some point, I've discussed this, and I said it's not accurate to say hearing loss. Hearing impairment is much more. It's much better. And the answer I got from some members of WHO was more in a way of trying to simplify things for the general public than for the scientific accuracy. So yes, I can understand that. Maybe it's obviously they had some data on how people better responded to the different terminology. So this is a way of trying to connect science with how to have an impact on general society, which is actually, I think, what we are trying to do here today as well, as with the other actions from this month regarding the World Hearing Day. So I think with that we can conclude if everyone is happy. Okay. Thank you all very much for your wonderful contributions, and I'm hoping that this will take us to a next level of trying to collaborate with WHO on trying to really move forward to the hearing impairment together with safe listening, and trying to simplify things as much as they can be simplified. Thank you all very much.
Thank you for a
Thank you.
wonderful
Pleasure.
meeting. Bye.
Cheers.
All the best.